devastating epidemic can start in any country at any time and kill millions of people because we're not prepared, because we're still vulnerable.
Epidemiologic investigations are underway, but yes, it's certainly possible that there's limited human-to-human transmission.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus. We have a window of opportunity. While the number of cases, more than 99%, are in China, in the rest of the world, we only have 176 cases. Let's use this window of opportunity to really invest in prevention, to invest in control, and prevent this virus from spreading. It's time to act. The detection of this small number of cases could be the spark that becomes a bigger fire. And if the world doesn't want to wake up and consider this enemy virus as public enemy number one, I don't think we will learn from our lessons.
We have over 400 scientists. There's been huge global interest in this topic and a real desire to collaborate and contribute.
Our window of opportunity is narrowing, and that's why we called the international community to act.
We've had enough countries now import disease. It is time to prepare. It is time to do everything you would do in preparing for a pandemic.
All countries can be looking for cases right now. All countries can be aggressively finding those first cases and following those contacts over time.
Shortages are leaving doctors, nurses, and other frontline health workers dangerously ill-equipped to care for COVID-19 patients. This is not a drill. This is not the time to give up. This is a time for pulling out all the stops. We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Not testing alone, not contact tracing alone, not quarantine alone, not social distancing alone. Do it all. You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test.
We must get back to be able to control this virus, live with this virus, develop the vaccines that we need to finally eradicate this virus.
Please work across party lines, across ideology. across beliefs, across any differences for that matter. That's how we can defeat this virus.
As the coronavirus continues to spread across the globe, the pressure is on for drug makers to develop a vaccine and bring it to market quickly. Vaccines are preventative medicines. They help reduce the risk of catching certain illnesses. They do this by imitating infections. They introduce dead or weakened versions of the disease-causing germs, known as antigens, into the immune system. When the immune system detects these foreign invaders, they create antibodies to attack them. And because our immune system is like a library, it stores information and remembers every germ it's ever defeated. So, if we encounter the real germ in the future, our immune system can quickly trigger the memory cells and produce antibodies to defeat it. Unfortunately, it takes quite a bit of time to develop, license, and release a new vaccine, ranging from several months to over 10 years. Once vaccines are developed in the lab, they must go through 3 phases before they come to market. First, small groups receive the trial vaccine. Then it's given to a larger group of people. And finally, it's tested on hundreds of thousands of people. Some experts say there's a 94% failure rate in developing a new vaccine from the discovery phase to licensing. The Food and Drug Administration will license it only if it's proven to be safe and effective, and if the benefits outweigh the risks. But the vaccine might not be worth the effort. Many viruses mutate, so a vaccine that works one year might be less effective or not work at all the next. Today, there's no working vaccine for HIV, malaria, or tuberculosis. So these diseases continue to kill millions around the world each year. But vaccines have led to the eradication of smallpox, a drastic reduction in polio, and progress towards eliminating tetanus.